Hi, this is Dr. Christabel Yeo. If you are seeing patients who remain mysteriously unwell in the months after COVID infection, join me for Bioceuticals Clinical Mastery, the Post-Viral Syndrome, on June 8th, where I will cover the key relevant strategies in post-viral syndromes, including immunometabolism, endothelial dysfunction, and mast cell activation. Go to bioceuticals.com.au to register.
This is FX Medicine, bringing you the latest in evidence-based, integrative, functional and complementary medicine. I'm Dr. Michelle Woolhouse, and today we're going to discuss the impacts of negative body image, which is much more prevalent than you might think. In 2017, a survey was done by the Butterfly Foundation. More than 43% of Australians are highly concerned about their body image. Additionally, over 1 million Australians today are experiencing an eating disorder, but only a third are getting help. Joining us on the line today is Dr. Gemma Sharp, a clinical psychologist who specialises in the treatment of eating disorders and body dysmorphic disorder. She is founder and leader of the Body Image Research Unit at the Monash Alfred Psychiatry Research Centre in Melbourne, where she's a senior research fellow. Gemma and her team focus on understanding the cause of and developing novel treatments for body image-related disorders. Hi Gemma, thanks for joining us.
Thank you so much for having me. It's brilliant to be with you.
I'm really excited about this discussion because it's such an important one. So I just wanted to start really with the basics. What is body image and how's it formed in our psyche?
It's a great question because I think people have a lot of assumptions around what body image means, but it's far more complicated than people give it credit for. So it's actually our thoughts, feelings and behaviours connected with our body. It's not just how our body looks, it's everything about it and our perceptions of it. And it has a great impact on how we view ourselves overall. So when I ask people about how they value themselves, what are the different facets of themselves, body image inevitably comes up. So it is a core part of our identity.
And how is it formed? Like, what are the factors that allow it to form? Does it form, in that really infantile stage, at the ages of 2 or 3 or before we're 7 years old? Like, do we know about how and when it gets formed, or is it ever evolving?
We are born with a sense of body image. We don't know it when we're first born.
That's amazing.
But even as young as 2 and 3, we have a sense of how our body moves throughout space and how it interacts with others. And then, of course, little children get compliments about how they look or comments. And so it starts really, really young. And as you said, it does evolve over time because our bodies evolve over time. But certainly it's with us all the way through our lives.
Yeah, it's such an important issue. I also, again, just to shape the conversation, I wanted to get some of the definitions kind of clear because often it's interchange between like an eating disorder and disordered eating. Tell us about that. Like, is there a difference?
There is, and I can understand why people might be confused. Again, we just use them interchangeably. So an eating disorder is where someone meets our diagnostic criteria for that particular disorder, and there's quite a few different types. So people would, of course, be aware of anorexia and bulimia, probably binge eating disorder to a lesser extent, but I think that is one that we're recognising more and more. And there's also what we call OSFED, which is other specified feeding or eating disorder, which doesn't quite fit into some of the other categories.
Right.
And then disordered eating is where it doesn't meet our clinical cutoff. So it's still problematic eating, but maybe it's not frequent enough or severe enough to meet our diagnostic criteria, but it's still very much an issue. And I would stress that if there's anyone out there who does meet that disordered eating criteria, that they should absolutely get help before it does start meeting diagnostic criteria.
Yeah, absolutely. It's almost like a scale of problematic behaviour in a way. Is
exactly.
that kind of,
so it might be like a binge once a month, or some semi-restrictive eating practices. It certainly has a lot of body image concern in it, and it's better to seek help early than not.
Yeah, and that's a great point, and we'll talk about where people get, help and resources later on in the chat. But also, one of the things that when I was researching this, and I think in our pre-podcast conversation, is just how body image can actually kind of almost like pop up as an issue at various different stages of people's lives, like things like pregnancy, where, I guess there's this, that you're meant to feel fantastically vital through pregnancy, but some women actually
I
feel
think illusion
challenged.
Is correct, actually. It does not seem to be the norm that people feel fantastic in pregnancy.
Moments of, but yeah, so, pregnancy, breastfeeding, there's so much pressure post having a baby about getting, the pre-baby body back, or, in the media, or menopause, perimenopause, adolescence. Tell us about how different key stages, and because I think this is really important for practitioners to know, to really be almost alert to that and open up a discussion with patients with regards to that.
Absolutely. Like, I think you've hit so many great points there. I think practitioners are aware that body image concerns can creep up in adolescence. I think we've got that right. That's, that time of usually a lot of growth and development, including brain development. But I think we tend to forget that our body is ever changing, and pregnancy is a time when a woman's body will go through radical changes, whereas her body might have stayed quite the same for quite a while of her adult life. And she's growing a human being in there. Of course, her body's going to change. But as you said, there's all that societal pressure of, this is the best time of your life. You have this pregnancy glow. But what if you're not feeling glowy? What if you're actually feeling a bit gross in your body? Who do you talk to about that? And I think there's a lot of stigma around saying that, hey, I'm really not enjoying how my body is changing right now. It's, even though I'm really appreciating growing a baby, I myself am dissatisfied. And then, as you said, there's all that pressure afterwards to just snap back to how you looked before, which again is completely unrealistic and perpetuated by media and society most often. And I think we need to, I suppose, move more towards a body acceptance approach after pregnancy, because your body won't be the same, because it has done an amazing thing of growing a baby. And that is very, very cool. And I suppose that's why I'm always about body function over form. I'm like, isn't that amazing? Yeah. You can grow a baby.
I love that.
Not everyone can say that.
Yes, it is a biological imperative. You need a womb and a couple of other little key components. But I think, the point that sort of struck out for me when you said is like, where do we go to talk about that? Because, I'm probably fall into that category of sort of feeling quite overwhelmed by the body changes of pregnancy. And I really didn't feel like I could talk to anyone about it. I'm talking for the first time now, in a way, just reflecting back of how important it is to know where we can talk about these issues, because it was actually quite full on for me, like the changes and the rapidity, like how rapid those changes were. It was like, whoa,
exactly.
I don't have time to catch up.
The only other time is puberty, when you're going through changes that fast.
Yeah.
And everyone expects you to be a bit all over the shop then, but no, pregnancy, you're meant to have it all together and just be like, oh yeah, great. And of course, you're not going to be able to maybe do all the self-care and things that you would normally do for your body because you're carrying a baby. It's really tough.
Yeah, that's right. And menopause is another big one, I think. There's we live in a youth culture. We live in a pressurized kind of culture that says a woman's body needs to look a certain way. And then menopause hits and there's a whole raft of different physiological changes.
My goodness. And if we don't talk enough about pregnancy, we don't talk at all about bodily changes in menopause. I didn't even think menopause was really in people's consciousness until fairly recently, it would seem. I suppose more mainstream rather than medical professionals. I think, agreed, it was sort of like, well, you just become older because, well, no, the cessation of menstruation really does have huge impacts on the body. And I think there's this, as you said, youth-focused culture. So it's like, well, now I have this definitive sign that I am no longer young, quote unquote, which I don't believe in at all. You're as old as you think you are.
That's right. And I actually had a quote, I think it was Instagram or whatever, with a 93-year-old yogi. So she's a woman, I think she's in Florida, of course. She said, I don't believe in age, I believe in energy. And I just thought that's just a great mantra to kind of think of.
It's so about outlook rather than the chronological number that you have reached. I mean, we have postmenopausal women doing amazing things, running countries, completing marathons, whatever they want to do. I suppose it's the next life phase and what you want to achieve out of that. So
I think in lots of ways we sort of think that this body image issue is actually a Western construct. But is this happening in other cultures? Like, is this happening in places like India or Africa or, some of the other kind of things? Are we noticing changes, through social media maybe or, the internet or sedentary behaviour? What's happening in other cultures, or is this just mainly kind of a Western thing?
It definitely does impact other cultures. I'm sad to say that our research really hasn't looked at other cultures enough, and that's something we are addressing now and finding, oh yes, this is not just a Western thing. In fact, when we find that when people from these other countries like India and Africa, as you were saying, when they come to live in Western countries, their body image distress becomes worse because they're surrounded by all of these Western ideals, and by virtue of their culture they are even further away from that than someone who, say, is Western born and bred. So we've got this, the perfect clear white skin, bright eyes, this Instagram look. And if you're, say, for example, from India, you are never going to have that kind of look. And so we know that with Western beauty ideals infiltrating these other countries, it is definitely promoting body image dissatisfaction, and it's something that we need to investigate more.
And I think it's worth us kind of as practitioners really, I guess, opening our hearts and minds to women or men of different cultures. And that kind of leads me on to the fact that we often think about body image as an issue that affects girls and women. But your research tells us that that's not the case. Tell us about the fact that, what's going on with men. Is this a rising issue of men? Has it always been there? How is it different for men?
It absolutely affects everyone. Anyone with a body can have a body image concern. So people of all genders, and I'm glad we're finally moving this research away from just girls and women. It obviously started there, and there's been brilliant research over probably the last couple of decades that has really shown that this is an issue. And I credit all those early researchers in the 80s and 90s. But I suppose it was more the 2010s that we're like, hey, what about men? Are they always happy with how they feel in their bodies? And of course, the answer was no. And we're seeing a rise in eating disorders in men. So I suppose when body image concerns become very severe, coupled with those eating disordered behaviours, we see eating disorders in men. So we know that this is a growing issue for them. And unfortunately, a lot of our, I suppose, treatment and prevention programs are very much geared more towards the female audience. And so men are far less likely to reach out for help, thinking that this is a woman's issue. So I think it's very much underreported, the statistics we even do have. I suppose what I will say is I do think it is experienced differently for women and men. I think women have generally always been valued for their appearance in society. I think that goes back a very long time.
Yeah,
I don't think men
Cleopatra's
always
age,
have that. Exactly. men tend to be more valued for their power and resources. I'm overgeneralizing here. I apologize.
Of course, but it does paint a cultural picture. I mean, I think it's certainly not the way, and it's certainly not the way we want it to be in the future. And I think there's lots of activity, the last 10 years is explosion of really putting gender on the table. But
absolutely, and gender diverse groups as well. Like they're another group, and of course there's lots in there: non-binary, transgender, intersex.
Yeah,
that's only a couple, and we know that they experience body image concerns at even higher rates because of this gender dysphoria at times that they're experiencing. So I'm glad we're finally shining a light on these other groups and saying, hey, we know that you're struggling with your bodies too, and we want to help.
Yeah, absolutely. I think it's just great to have some words around it too, like so that we can start to open the conversation, because body image and poor mental health are actually connected, through the research that you've done. So I'm just wondering if we know, is it a chicken or the egg kind of scenario? Does one lead to another, or how does it work? Do we know?
It's a great question, and I think it's very much a complex interplay that one feeds into the other. Like if I'm feeling anxious, I focus on my body. If I focus on my body, I'm feeling anxious. It lowers my mood. It makes me not want to go out, which makes me feel isolated. I feel judged when I go out by others because of my appearance. Like it's so... there are just so many factors at play here, but you're absolutely right. It's this bi-directional relationship with overall mental health and body image.
So it is, I mean, I think for practitioners listening to this, like even if we've got like a sniff of body image issues, like, it really is important from a prevention of mental health issues to see whether we can support people differently with that and open a conversation.
Absolutely. And I feel like, I suppose from my own patients, like we don't ask about body image enough. Like say if someone has come to me for, say, OCD or depression or something like that, and I'll say, oh, and how's your body image? And they're like, oh, terrible. But that's not their primary presentation.
Yeah.
But I think if any health professional asked, they would probably get it's not great answer for people's sense of body image.
And I think, it's like so many things. Like if you go back to, early psychiatry, Jung would say, like, everybody comes with a story that's never been shared, in their psyche. And so as we speak about these and as we share, there's that shared humanity, which is also part of the healing. So,
absolutely. And I think we as health professionals own our own body image journeys as well. Who of us can say that we are satisfied all the time?
That's right. But your research also, has explored personality traits on body image and sort of, made the kind of connection. Tell us a little bit about which kind of personality traits kind of affect us more. Is there something we could look out for or support people through, or...
This is such a complicated issue, because if we think body image is complicated, personality is even more complicated. And I have a great PhD student looking at this at the moment. I hope by the end of her PhD I'll be able to answer this question even better. So what we tend to find, I suppose there's kind of two major traits that we talk about in eating disorder space or body image space. And the first is perfectionism. We know that perfectionism can actually be really beneficial sometimes. Helps us get good grades at school, get promoted at work, throw awesome parties, things like that. But sometimes it can
attention to detail.
Exactly. Yeah. You want that in a surgeon, don't you? You don't want someone who's a bit slapdash. So it can be really helpful, but it can definitely go into that pathological realm pretty easily. And when focused on the body, which we know is inherently imperfect because it is our body, then that's when it's an issue. So sort of that appearance-oriented perfectionism is quite problematic. And the other is neuroticism, going back to our sort of 5-factor model of personality. If your listeners have heard of that, check it out if you haven't. So yes, being a bit more intense about things, like neuroticism covers a range of behaviours. So I suppose my PhD student is drilling down on that a bit more, which I'm pretty interested in.
Yeah.
So I think that's a really evolving space. And I think at the moment, our treatments don't take into account enough individual personality traits. We tend to sort of deliver the same kind of treatment irrespective. Perfectionism is something we tend to address a bit better. But in terms of other things like temperament and personality, we don't do such a great job at the moment.
Yeah, they're trickier. Well, that kind of
They
leads
really
me
are.
into, it's like we've got personality traits and, we've got family of origin. But one of the big issues that's changed over the last decade is, of course, social media and its impacts.
Yes.
Channels such as Instagram, Facebook, TikTok, and it's very difficult for parents, particularly after these lockdowns. It's almost like the landscape has changed dramatically. I know myself, we recognise that, from a social perspective, we needed to loosen the reins, of our 1 hour a day kind of thing through lockdown.
Yes, more like 23 hours a day during lockdown.
Yeah, and the horses definitely bolted. So tell us about the research for social media and how much of an impact do we know that it's happening on body image?
Yeah, so it's such an interesting space, media impact. So we knew that media was having an impact decades ago, like movie clips, music clips, magazines, things like that. But now social media has really changed the media landscape even more because it's so interactive. You're part of it. For example, TV shows and magazines you just sort of read and watched. You weren't really a part of it. But because social media is so interactive, there is the chance for more harm, unfortunately, but also more good too. I think social media gets a bad rap sometimes. I think it does connect people who may not have a community. So I think we shouldn't forget that. In terms of social media's impacts, so we know that it's not necessarily the amount of time young people spend on there. So obviously I don't want your listeners thinking, 24 hours a day is fine. But if you're a young person is spending quite a bit of time on there, it's okay. It's more the activities which they are participating in that have the potential for harm to their body image, and these tend to be more of the photo-based activities, so taking selfies, editing selfies, posting them, looking at other people's selfies and photos. So it's really the images that have the most powerful impact on body image. And if we think back to, say, magazine covers and things like that, it's a little bit like that, isn't it? Except now we all have smartphones and can edit our own photos. And so now we have that technology to use on ourselves.
Yeah, and I guess it's the normalisation of that, like the normalisation of beauty pressures, like we were speaking to our daughters about unrealistic beauty ideals, and the impact of them. Like, like we know that they're filtered and whatever, but I know when I look at a filtered image of myself, if I've got a filter over the top, I'm like, wow, that looks better.
Absolutely. It's that classic before and after. That's the basis of cosmetic surgery. The before is always pathologized and the after is glorified. It's really challenging.
Right. So it's it's challenging, like even for a 49-year-old woman, like, to have these kind of things goes, for young teenagers, like that's what they actually at times aspire to. So because what I was looking at through the lockdown was just this, because in the News GP there were coming reports of the Royal Children's Hospital, emergency admission rates for things like, self-harm and body image issues and eating disorders in teens due to the lockdown. Do we know much about that yet? Like, do we think that this is going to be an ongoing trend? What are we doing about, this recent imposition that happened that is almost kind of thrown all of the cracks open?
Yes, I think we're still managing this. I can't see, maybe I'm cynical, I can't see things getting better quickly. You're absolutely right that it showed that we didn't have enough workforce in this space.
Yeah.
And this isn't something that's addressed quickly either. It takes time to train people and build up the workforce. So we know that wait lists are longer than 12 months for specialised eating disorder services and things like that. It's, I had to close my books because I just couldn't take anyone else on. So I'll be very interested to see what happens with this cohort of young people. I'm sure they'll be the most studied cohort of young people ever, because they've lived through a pandemic at that particular time of their lives. I do know that particularly with young people, the earlier the intervention in the eating disorder realm, the better. We tend to actually have very good outcomes with adolescents and family-based therapy for eating disorders. But when they, I don't mean to be, I suppose, a Debbie Downer or anything like that, but when it comes to people who are in their sort of 20s, 30s, 40s, if they're coming to treatment for the first time, we tend to not have as good outcomes. It doesn't mean they shouldn't come, but just the earlier someone can get into treatment, the better, particularly as a family unit as well. We just know that works brilliantly rather than individual therapy later on.
And is there something we should be, is there a certain language we should be using around, ideas of body image or food or, exercise, for example, like as a lot of our practitioners are going to be parents as well. Like, is there something that we can do from a prevention or even as family members? Like, is there something that we know that can be really helpful?
Yeah, we know that people's families are very influential in how young people form a sense of their bodies. Obviously, their peers become quite important later on, but certainly at those earlier stages, it's parents and siblings and grandparents, whoever's around. And I think first up, if you have your own body image concerns as a parent or carer, please go see someone, because even you talking about your own body does impact how the young person around you looks at theirs. Even if you're not talking to them directly, they really pick up on how bodies are talked about. If you're on any kind of diet or anything like that, please don't mention it in front of the young person. So I suppose, sorting out your own sense of body image is a really good thing. In terms of how you talk to them about their own body, if you can avoid, I suppose, more appearance or weight-based conversations, that's really, really, really helpful, because they tend to never really go that well. I know some people will say, well, can't you compliment someone if they're looking good? And of course you can do that. But I would rather hear that kind of compliment mixed in with, oh, aren't you good at tennis? Or wasn't that a kind thing you did for your brother? It needs to be mixed in with compliments about the person's character, what they do well. I suppose it comes back to, how little girls are always told, don't you look pretty? And little boys are like, oh, don't you play with trucks well? It's readdressing that, really. It's like complimenting people for what they do rather than what they look like. So I think it's just, I suppose, treating young people like whole people from the start and not really having those appearance-based conversations very often, and talking about other people as well. Like I hear this, oh, isn't she a bigger person or something like that? Even talking about someone else, just don't talk about people's body shapes, full stop.
That's right. I think that's a really great thing. And even if we're picking up our unconscious bias, because I think as a culture we've been so ingrained about body image and what we look towards the outside world, so even picking it up in yourself to go, wow, I actually identified that person as a big person. But, and also noticing how much we do that with women and not men, or et cetera, et cetera. Yes. So I think noticing the differences that we do, even just our own unconscious bias, can be so supportive. But that actually leads me to orthorexia nervosa.
Sure.
And so I've been fascinated with this. I've been working in integrative medicine for 20 years and obviously been prescribing, different nutritional interventions and diets, and been really conscious of the aspect of orthorexia nervosa, which came in when people were really, like I had a group of people that I struggled to get them to adhere to a diet, and then others would be like, yep, I'm on. Here you go. What food do you want me to restrict? I'm there. I'm done. Like, yep, I'll say no to this. And, it's like, whoa.
Okay.
And also the research shows that orthorexia nervosa or those kind of issues are actually much more prevalent. Like in one study, it showed 68% of dietetic students had aspects of orthorexia, and...
Isn't that a worry?
Yeah, dietitians had a twofold increase in eating disorders as compared to control. And,
so what are they saying to their clients and patients?
Yeah.
That's a worry.
And naturopaths and nutritionists, would fall into that, and then personal trainers and etc. tend to have more of an inclination towards an unhealthy relationship to food. And when we're prescribing that, do we know enough about that? Is there any support for people that are working in the diet industry, diet, weight loss, health industry, etc., that we can kind of shine a light on and see whether we can support that? Because obviously that's an issue for people coming for support as well.
It really is. I think orthorexia nervosa is so interesting. It's not in our diagnostic and statistical manuals yet. I'm not sure if it'll make it into the next iteration. I'll be interested to see. And I suppose there's this debate, is orthorexia nervosa just anorexia by another name? It's sort of the socially acceptable eating disorder, which I don't like one bit because it's still very harmful. And as you said, there does seem to be a higher incidence in certain types of professionals who tend to encounter people with eating disorders, which is a real struggle. I think potentially programs, for example, dietetic programs at university should be maybe screening for these behaviours before permitting people into these programs, not excluding them, of course. However, maybe saying that perhaps they could benefit from seeing a psychologist in conjunction with conducting the program, just to make sure that they are not unintentionally passing on any harmful messages to their clients. And I suppose, I was speaking to a group of dietitians last year, and I realised that unlike psychologists, they don't have peer consultation. They don't really talk with other dietitians very much. At least that was my understanding from my interactions with them. And I think it would be very hard for a dietitian to say to another dietitian, I think I'm a bit worried about my eating behaviours, because they're meant to have it all together, because that's their dietitians, their personal trainers. They're meant to be the experts in this. So it would be quite shameful, I think.
And I guess it's similar to psychologists that have anxiety and a breakdown, because often...
I've never met a psychologist without anxiety. I think it's part of the job description.
But I guess we do naturally get attracted to what we feel is kind of our most, pertinent sort of relationship in many ways. So it's kind of a natural... As
you were saying, like a psychologist whose anxiety is maybe escalating, they would talk to another psychologist. They might be seeing a psychologist themselves. In fact, a lot of people in the field do. And I think that's really, really helpful. And I think if other professions were to have that, where they could talk honestly to each other about struggles that they're having within themselves that might be impacting their clients, all the better.
I think that's a fantastic idea, because I know myself as an integrative GP, there'd be sometimes when I did see, a patient that was, really adhering to a diet in such sort of vigour. And I'd actually question myself and think, why can't I do that? They seem to be able to do it so easily. Or, whatever. We take
what? I'm glad you can't. That's really good.
But, I guess we're all human and we share this human journey. And so, really what we're suggesting is
going to identify or not identify with our patients and clients to some extent. We can't leave, as you said, our human side out of the clinic room. It's always there.
That's right. And I think, encouraging people to speak about it, to our patients, but also to ourselves, like we become a kind of mirror, of the people that come into our clinic. It's just remarkable how much we share our humanity with other people, even with vastly different backgrounds.
It makes you the best practitioner you can be. It's why you're not a robot.
Yeah, that's right. Talking of robots, what a beautiful segue and completely unplanned.
Thank you. I can't imagine what you're about to ask me.
So Gemma is such an innovative psychologist, probably one of the most innovative in Australia, has created this incredible resource. Tell us about what you've created. Tell us about Kit.
Well, thank you for the opportunity to talk about my chatbot child, Kit. I'm super proud of Kit. And thank you so much for the lovely innovation comments there. I really appreciate that, because I think in mental health there's so much demand and so few of us that innovations are absolutely crucial, and the pandemic really pushed that along. And Kit was launched in November 2020. Kit's a chatbot, which is a computer program that has human-like conversations. And Kit focuses on teaching, I suppose, two types of evidence-based body image skills. The first being basic education around what body image is, what it isn't, what to look out for in yourself and others, what treatments are available, that kind of stuff. So the nuts and bolts there. But Kit also has 19 different coping skills that I would routinely teach in my practice. These are generally cognitive behavioural therapy and mindfulness based, which we know has positive impacts on people's body image. And I think because Kit's there 24/7, freely available, a cute character that people seem to really be attracted by. Kit's had over 23,000 users in just over a year. So we're really, really excited that people are benefiting from Kit and enjoying speaking with Kit.
Oh, that's so fantastic. I've had a play of Kit, so I'm one of the 23,000. And I would encourage all of our listeners to have to go online and have a play with Kit. We'll obviously have links on the website to Kit.
Oh, thank you. Yeah, just go on Butterfly's website and you'll see a green pop-up there.
And I think also to familiarise ourselves with what he does, what he can do. So if we're asking patients about body image, or if any of our listeners have kind of identified that maybe they could explore the issue a little bit further as well, Kit's a great place to start, and then I guess seeking help and other resources as well. So Gemma, thank you so much for being on the show with us today to discuss negative body image and what it is and how significant an issue and impact it has on our lives and our relationships. And you've helped give us a hugely beneficial understanding of how society's expectations and social media play a role in it as well. I guess particularly what I loved was your focus on body function. So what does my body do? Like focusing on that experience of what it feels like to do things with our body rather than what they look like, and how we can better support people to build better body image for ourselves and for our patients.
Thank you. Yeah, I think this is an area we all continue to work on. It's an evolving space, and it's just so exciting to see the future directions in the field.
And don't forget to check out Kit. So thanks everyone for listening today. Don't forget that you can find all the show notes, transcripts and other resources on the FX Medicine website. I'm Dr. Michelle Woolhouse, and thanks for joining us. See you next time.
This podcast is intended as healthcare practitioner education only, and it is not a substitute for medical advice, diagnosis or treatment.
Hi, this is Dr. Michelle Woolhouse. Join us on FX Medicine next week, where we'll be talking to Dr. Gemma Sharp again as she joins us for part 2 on our series on all things body image. Subscribe to us on your favourite podcast app and follow us on social media to make sure you never miss an episode.